Hello everybody, my name is Jacqueline Panduro and my presentation will be about acute lymphoblastic leukemia. Acute lymphoblastic leukemia is a malignant cancer of the blood and bone marrow. There's two types of lymphoblastic leukemia, chronic, which is slow paced, and acute, because this type progresses very quickly. In this PowerPoint, I will be talking about acute. It's lymphoblastic because it has to do with the lymphocytes of the immune system, also known as white blood cells. Our bone marrow makes hematopoietic stem cells, which can turn into various types of specialized cells of the blood. In this type of leukemia, too many of our hematopoietic stem cells become lymphocytes, specifically lymphoblasts, otherwise known as immature white blood cells. There's so many of them and not enough erythrocytes that the patient's immune system starts to function improperly and not fights disease very well, leading to death. In the year 1844, John Hughes Binet, a pathologist at the Royal Infirmary at Edinburgh, first published leukemia in a clinical paper after receiving two patients with odd blood consistencies and an enlarged spleen. In 1847, Dr. Rudolf Virchow named leukemia. He named this cancer when a 50-year-old woman was admitted, suffering of fatigue, an enlarged spleen and liver, and her blood seemed to have a pus-like appearance. In 1913, various types of leukemia were known, but no successful treatments were available yet. They initially tried to treat this cancer with blood transfusions, but that had failed, so they tried radium. Of course, patients treated with radium soon died, although to this day, because radium proved to be somewhat effective in the treatment of this cancer, we continue to use radiation therapy as a treatment for leukemia. Symptoms of acute lymphoblastic leukemia include the following: fatigue, dizziness, shortness of breath after doing minimal tasks such as walking a short distance or bending down to pick something up, pale skin, bruises that are unexplainable or just randomly appear on the skin, abdominal swelling due to an enlarged liver and/or spleen, and weight loss due to loss of appetite. Frequent bleeding such as recurrent nosebleeds and very heavy menstrual periods in women are also common symptoms. According to the American Cancer Society, in the United States, there are about 5,930 new cases of ALL total per year, 3,280 being in males and 2,650 being in females. There are 1,500 deaths of ALL per year, 850 in males and 650 in females. Most cases of ALL occur in children younger than 5 years old. 4 out of 10 cases occur in adults. Risk declines until mid-20s and after the age of 50 picks up again. Children generally do better in recuperating from this cancer due to their bodies being able to handle more aggressive forms of treatments than adults. The image that shows the graph is from the National Cancer Institute, and we can see that most cases of ALL are in people younger than 20, about 56.1%. Diagnosis is usually found by performing blood tests on the patient and a complete blood count. A complete blood count is when blood is drawn from a patient and the number of lymphocytes and erythrocytes are counted. The amount of hemoglobin in the erythrocytes is also recorded. A bone marrow aspiration and biopsy is performed and reviewed under a microscope to check for abnormal cells. There's 4 types of treatments: chemotherapy, radiation therapy, chemotherapy with stem cell transplant, and targeted therapy. Chemotherapy is a treatment that uses drugs to stop the spread of cancer cells. It may kill the cells or stop the rapid division. Radiation therapy uses high-energy X-rays. It may be administered through a machine or through needles, seeds, and wires. Chemotherapy with stem cell transplant is when the patient receives a bone marrow transplant from a compatible match and is then treated with normal chemotherapy. Targeted therapy uses drugs to identify cancer cells and leave healthy cells unharmed. The 3 most important ways you can prevent ALL are to be a non-smoker, maintain a healthy diet and exercise regularly, and avoid inhaling benzene and formaldehyde fumes. Thank you so much for watching, and I hope you enjoyed my presentation.